Consent agenda. All of the following items which concern reports and items of routine nature normally approved by AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all of the items. The consent agenda consists of discussion, consideration, and action on the following items. A, minutes of the special trustee meeting January 29th, 2024. B, the finance committee meeting February 20th, 2024. And C, the check report January 9th, 2024 through February 8th, 2024. Do I have a motion to approve the consent agenda?
I make a motion to approve the consent agenda A through C as presented.
Okay, I have a motion by Dr. Brown. Do I have a second?
Second.
I have a second by Dr. Simon. Any questions? Roll call?
Martin?
Yes.
Bowman?
Yes.
Simon?
Yes.
Mossberg?
Yes.
Brown?
Yes.
Hannaford?
Yes. Item number 3, CEO's report. Candace.
All right, moving right along on the Senior Life Solutions program. We have meetings weekly, ticking off a whole host of action items that have to be completed before July, so that's moving along. The surgical services, Dr. Addison Roberts actually did his onboarding today. I had it as yesterday, but it was actually today. So getting him started and exciting to get that started back up. Equipment, installation of the patient care boards and all of that has been completed. We have some software issues that are still outstanding that they are continuing to work on. The old mammography equipment was removed last week, and installation for the new one is slated for the first week of March. Revenue cycle management. We had a call last week and with our account manager, and we have scheduled, and I have a meeting, I think, this week, I think tomorrow coming up, and then another one with Gregory scheduled. And then we're going to make that a monthly meeting at a little bit higher level to try to drive more accountability to our revenue cycle process. I will say, after looking at the reports today, we have had, the last 3 months, we've had the highest gross revenue we've had since October of 2018, so that's pretty exciting. I have interviewed 3 nurse practitioners to help in the urgent care. I have one hired that she will start the first week of March, I believe it is, to help out in covering those urgent care hours. Just a shout out to Jennifer Nichols, Brian Nutter, Steve Madrid. They have done a fantastic job covering that. They each take a couple, like 2.5, 3 hours out of their clinic on Tuesday, Wednesday, and Thursday to help cover that. Brian covers it on Monday, and then Jennifer has flexed her day. Instead of working Monday in the clinic, she works in urgent care on Fridays. And then they rotate the weekends. So they've done a great job covering it, and of course, it happened during the busiest time of the year as well. We went through flu and COVID, so they've done a remarkable job, and I just want to thank them for that. So of course, with all of that, clinic visits have also been up. We were at 1871 this year compared to 1617 last year, I believe it was. We do in nursing, we've got 1 agency nurse hired. We try not to do that, but nurses are really hard to come by still, and so we do have an agency nurse under contract for the emergency room for 13 weeks. We're also partnering with Northwestern and being a leadership rotation site for one of their senior nursing students currently. Carly Dietz, if you remember, we hired her back a couple months ago, and she has completed her mammography training in Las Vegas, and so we obviously gearing up to get our mammo machine in service, and we're looking at probably April when we start seeing mammography patients again, which is sooner than I thought it would be. I figured it'd probably be more like July, so we're glad to get that rolling right along. Mark Almac reported that for the first time in 5 years, we were able to submit our meaningful use data. That is something the government requires, and if by this time, this was the 5th year, if we did not begin reporting it, then we would start financially getting penalized. And so that, again, was one of the drivers behind having to upgrade to Expanse. That was another driving force for doing that. So glad that he's got everything in place to be able to do that reporting. Coding is going well. Kelly, along with CodeQuick, is keeping our coding up within the 4-day goals that we had set. The new chemistry analyzer for lab is here and sitting out in the hallway, running tests to make sure it's working correctly. Rim, her newest lab employee from the Philippines, is here and working and getting acclimated to her new home. We're excited to have Rim on staff. Coco desperately needed the help. Kelly's been doing a great job getting back into the swing of things for doing marketing, and we appreciate that. You can probably tell by our social media that is more pronounced than it has been. He's done the heart health for February, the Survival Flight membership event, which was well received. We had lots of people come up and sign up for Survival Flight. We've had a blood drive, and are you getting started on the needs assessment with OSU?
No, that was what they sent out for community surveys,
Gotcha.
and we shared it.
But we are going to be doing that before long, hopefully, getting our primary needs assessment done. They do that every so often. They pull the community members together and do kind of like an advisory board meeting to see kind of what the community thinks we need. And then Senior Life Solutions kickoff meeting. Dr. Tepper's been very busy. We kind of created a new space, not new space, but utilizing some space that was unused for Dr. Tepper's clinic closer to the surgery area, and give them a little more space and quiet for Dr. Tupper to do his dictation. So that seems to be going well. And really that's all I have. I'd be happy to answer any questions that you have for me.
Any questions for Candace? Hearing none, do I have a motion to approve and accept the Share Medical Center written report for February 2024?
I move to approve the Share Medical Center written report for February 2024.
Thank you. I have a motion by Dr. Simon. Do I have a second?
Second.
Second by Mr. Bowman. Any other questions? Roll call?
Bowman,
Yes.
Simon,
Yes.
Mossberg. Yes. Brown,
Yes.
Hannaford,
Yes.
Martin.
Yes.
Okay. Item 4, CFO report. Angelica.
All right, so we've had a good month in January. We did close our cash balance out at $87,532. Our hospital accounts receivable decreased to $3.9 million. We had suspended sending any accounts to collections during our implementation process, and so we've now began that process again. So part of that accounts receivable balance going down is because we did turn accounts to collections. So we did have some conversations in the Finance Committee to discuss what efforts we can make to collect those monies internally and trying to prevent them from being turned to collections. So we're working through that process and hopefully can see some additional cash collection due to that. If you look at our gross days in AR, we have made some progress. Our numbers are still higher than what we would like them to be. Our unbilled is sitting at 7.7, but we're really close to that 6.6 days. That is the KPI that we're trying to meet. Our billed gross days is down to 80.6 days, so we're quite a bit closer to the 55 days that we want to be in total overall. We went down 20 20 days there from 105, that's not right. We went from 105 to 100 to 88.3. Yes, 18 points there. So we're making progress. We are still working to get all of the wrinkles straightened out from the implementation. I think billing statements are now going out regularly. We aren't. There are still some hiccups along the way, but we are addressing them as they come up and we're getting them worked out. So we should continue to see that number decrease. Our hospital accounts payable, we closed the month of January at $1,330,000. We did receive our cost report settlement for fiscal year 2023, and then we also got our interim rate adjustment for fiscal year 2024. And so together we collected a little over $700,000 from that. So obviously that helps drive accounts payable down. We did pay off the line of credit. We had pulled down some draws from our line of credit, so we paid that off completely. And we're working to just move those vendors forward and get them paid off, trying to avoid pulling down from the line of credit, but we may have to do that at some point in time. So we are working to get that down. I think when we closed at the month of January, we were at 120 days out on our accounts payable, and we're working to just move that needle forward. Gross patient revenue, as Candace pointed out on her report, we had $2 million in gross patient revenue, which is the highest that it's been in an extremely long time. So we're hoping to see that continue to increase. We did have a total of 47 patient days in the month of January, so that was about 20 days less than what it was in the month of December, but still a good number. And our ER visits were 271 ER visits, which that number we have seen an increase in those visits, which helped contribute to that gross patient revenue. Our clinic gross patient revenue, that one, we had $505,000 in clinic revenue. Our providers in the clinics, as Candace pointed out, for urgent care, it's been the busiest time. We've had 1,871 clinic encounters. That's a lot of people to be seen in that time frame, but they did a great job. But we do have quite an increase in revenue there. Hospital operating expenses. So we had $632,204 in hospital operating expenses. We did have an AP clerk go out on leave and some things that got a little bit behind at the end of the month in December, And so getting those things caught back up in January, we would see a little bit of an increase in expenses in January, which is really probably offset between the 2 months. We had a net income of $628,196 for the month of January. So obviously a lot of that was due to our cost report settlement. We also did receive some Medicaid gap funding as well. So those things help get things paid down, and we'll keep moving forward. What questions can I answer for you all?
Any questions for Angelica? And I know most of you look at it, those charts are really helpful in looking at, especially like the operating expenses, although we've really made some significant progress over the last several months in getting those expenses down, which has been good. So I really appreciate the extra graphs and explanations. Any other questions? Okay, we'll move to item B, which is an approval or disapproval to purchase an iCAD U-Scan, is that correct? From GE Healthcare in the amount not to exceed $53,176.80. Angelica, would you like to?
So this piece or software, it goes in conjunction with our Mammo machine. Candace, correct me if I'm wrong, it allows us to read the 3D images that we'll be able to do with our machine. It's just an upgraded technology. It's an add-on, but very important.
It uses AI technology.
Yes, very important to that piece of equipment. So we did receive funding, 2 different donations, the amount of $350,000 When we approved the purchase of the Mammo machine, it was at $272,000. So this is still under that $350,000 that was donated to us. Also allowed for us to send Carly to training, and then it will allow for some remodel that we need in our Mammo space when they took the old piece of equipment out and they'll put the new piece of equipment in. So we still should stay under the budget of the money that was funded to us.
Any other questions on that? Okay, do I have a motion to approve the purchase of the iCAD U-Scan from GE Healthcare in the amount not to exceed $53,176.80?
I move that we approve the purchase as presented.
Second.
I have a motion by Dr. Brown, second by Dr. Simon to approve the purchase of the iCAD U-Scan from GE Healthcare in the amount not to exceed $53,176.80. Roll call?
Simon?
Yes.
Mossberg?
Yes.
Brown?
Yes.
Hannaford?
Yes.
Martin?
Yes.
Bowman?
Yes.
And that pretty much takes care of that grant then. Okay. Or donation. Move to item number 5, the medical staff executive committee. Dr. Burke was unable to make it to tonight's meeting. I talked to Candace. Really, the agenda was pretty much about the credentialing. So we will move to B, the credentialing committee. And I will look for a motion to appoint to courtesy staff Dr. Addison Roberts, DO, General Surgery.
I'll move to appoint to courtesy staff Dr. Addison Roberts, DO, General Surgery.
Second.
Who was second? Okay. A motion by Dr. Simon, second by Mr. Bowman, to appoint to courtesy staff Dr. Addison Roberts. Roll call?
Mossberg?
Yes.
Brown?
Yes.
Hannaford?
Yes.
Martin?
Yes.
Bowman?
Yes.
Simon?
Yes.
And again, in your packet, you've got your information about Dr. Roberts. Item number 6, coffee. Can you say anything?
Nothing special unless somebody has questions. If you reviewed your minutes and have any questions, be happy to answer those. Once again, staff is just gearing up. Anytime after March 1st, our survey can happen, so we're just getting ready, trying to be ready for survey. Do you have any questions?
Any questions on coffee? Okay, hearing none. Move to 7, improvement to patient care. Letter A, contract review of quality evaluation. Candace, do you want to cover that?
Looks like all of those were compliant. 3 were archived.
Any questions for Candace on the contract review? Okay, hearing none. We'll move to item B, which is discussion and action to approve or disapprove the revisions report dated January 31st, 2024. The following items from 7C and 7H are all to, oh wait a minute. We just need to approve the revisions report first.
I make a motion we approve the revisions report dated January 31st.
Second.
Have a motion by Dr. Brown, a second by Mr. Bowman to approve the revisions report dated January 31st, 2024. Roll call?
Brown?
Yes.
Hannaford?
Yes.
Martin?
Yes.
Bowman?
Yes.
Simon?
Yes.
Mossberg?
Yes.
Okay, so now we'll move to the following items from 7C and 7H are all routine policies and procedures. They will be approved or disapproved by one vote unless any member desires to have a separate vote on any or all of the following items. Candace, do you want anything you need to?
No, I was just going to point out, in your summary report, you can see under the final review remarks, you can see why, when that policy came to committee. For instance, the security management plan moved from policy to procedure. The second one was MRI renal angio. They updated the dosing recommendation per DIA protocol. So it gives you a short synopsis of why that policy is here for review, or it might just be its annual review, if you have questions about that.
Any members desire to have a separate vote? Okay, so we will be voting or looking for a motion to approve items C through H, the approval of the elopement procedure, the approval of left without being seen procedure, the quality risk management plan, the medical equipment management plan, the life safety management plan, and the hazardous waste management plan. Do I have a motion?
Make a motion that we approve items C through H as presented.
Second.
I have a motion by Dr. Brown, and a second by Dr. Simon to approve items C through H. Any questions? Roll call?
Hannaford,
Yes.
Martin,
Yes.
Bowman,
Yes.
Simon,
Yes.
Mossberg,
Yes.
Brown.
Yes.
Okay, item H, share convalescent home report.
You can see the written report in your packet. I will point out just a couple things. As far as census is concerned, census was up about 2.5 patients per day, so that was good. Our skilled nursing days were more than double compared to December, and that was reflected in our revenue and in our ultimate net income that we had this month, or for January. The nursing home sale is going to have to go to a vote of the people. We worked with Drew and some other legal counsel with the municipal league. There's, I guess it would be case law, is that correct?
Yes.
Case law that would require the nursing home to be at a vote of the people instead of being able to be done with any other kind of amendments to agreements and that sort of thing. So the earliest we can be on a ballot is June 18th. So we'll be working to get the ballot language together so that that can get out in front of people for a vote. In the meantime, we're still working with Beatles and moving in the direction of that transition. In January, Nedra Kettler started as our MDS coordinator. We were able to bring her in. That's what she does for Beatles. She just stepped right in, and it's not been an issue for her to step in and do ours as well. We were able to terminate the contract with Polaris that we had, where they were doing remote MDS coordination. So that's going to save us a little bit of money. Starting March 1st, Dana Jordan is going to assume responsibilities as the director of nurses for our nursing home. And so that I think is going to go well. We've got, some things that have, some boxes we haven't checked over the last 6 months, not having a dedicated director of nurses. Christy Williard has done a great job, serving that capacity for us, but she's also been a floor nurse for about 4 shifts a week. So we've got a little bit of catching up to do, but we know what those items are, and we're getting them caught up this week. They are sending more staff up to help us fill our schedule. And in fact, they've taken over writing the schedule for us and using both our staff and their staff to fill the shifts in both buildings. And that's going fairly well. A little bit of hiccups whenever you change some of these things, but overall that's going well. I don't have any agency nurse aides on the schedule so far for March, so that's good. And we did wrap up our contract with our agency RN, and she had her last shift on February 23rd, I think. And so she came in, and we thought we were going to have her for 8 weeks. And so, 8 months, 8 weeks, just typo. But anyway, that'll save us some money as well, to have the nursing and nurse aid staff from Beatles up in our facility. Number one, it's letting them get used to our people and you know, where the water cooler is and all that kind of stuff. And it's really going quite smoothly. You know, you don't know what to expect sometimes whenever you have something like this happen, but really it's going very smoothly. So, any questions about that, the nursing home? As far as the financials are concerned, we did have a slight net income for January, $7,778. Like I said, our revenue was up. Our expenses were down some, and our salaries were down as well. So the overall impact was that we didn't lose money in January, so that's good. We do have year-to-date a net loss of $240,000, almost $241,000, but compared to last year, that was a net loss of $283,000, almost $284,000. So financially, there has been an improvement this fiscal year versus last, and I think, you know, that kind of all the things that we're doing from a just a compliance standpoint with the Nursing Home Practice Act and all that stuff, as well as the finances, I think, are going to, and then when you combine that with a vote of the people, I think that's going to probably bear some weight when the state goes to make their decision on, because ultimately the state has to decide whether or not the transaction is okay. So I think we're doing everything we can. I think it's going to be all right. Any questions on the nursing home finances?
Okay, you want to move to the homestead?
No. Homestead had another good month in terms of they did increase census a little bit. They completed flooring installation in 3 apartments, and so we did see, as a result of that, we did see some increase in expenses that we don't normally have, but we've got 3 more apartments that are ready to rent, so that's good. From a staffing standpoint, Merla Sims is going to be transitioning from the activities director at the nursing home to the resident services coordinator at the homestead. Jordan Gray is resigning her position, and so Merla will do a great job over there at the homestead. I think she's fantastic. Jordan's fantastic too, but Merla's anxious to get started over there. She'll start on March 8th. So, any question about homestead activities? Homestead finances. Revenue was $57,000, almost $58,000 for January, which technically was probably the highest revenue month. I know if you look at your 6-month comparison, August shows $99,000, but August included some makeup revenue that was from previous months. So, but for January, that was good. As I mentioned, with the refurbishment and whatnot to some of the apartments, the expenses were a little bit higher in January. And so we had a loss for January of $8,082. But year to date, the homestead is in the black, $6,000. So, any questions on the homestead financials?
And the foundation?
Foundation received a $100,000 gift from a local family for the mammography. That'll probably end up being on the March financials, probably for the hospital as income. And so we're looking forward to being able to get that money moved over. I will also issue a challenge if anybody's interested. The there's some relocation expenses for the RAM coming from the Philippines that we're wanting to try to assist with, and one of the providers has given a $500 challenge gift. So they're willing to match dollar for dollar any donations that go to help for that. And so if any of you are interested in making a donation, then let me know. We can make that happen.
Do they have an estimated cost of what they're trying to raise, or?
I think we're trying to get to 1,000.
Any other questions for Kelly on the foundation? Okay, item 11, St. Anthony's report, nothing. Greg, 12, city council report.
Okay, the Oklahoma Natural Gas franchise fee passed from the special election on 2/13. I will say, from what I understand, it's one of the best deals any community has on that with the provider. The MRDAF grant came in to resurface Flynn Street from 281 to 460, which would be where the prison and Fechner's is, and then 460 to 64. Firefighter negotiations are starting. Councilman Bear and myself will be representing the city. And alternate bids for the amenities of the swimming pool, which was lighting, children's play structures, spray ground elements, floatable structures, group shade structure, and climbing wall were all approved. And other than a small amount, everything for the pool has been covered in donations.
Good job.
That's about it.
Okay, any questions for Greg? Chairman's report, I just want to give an update. I had a couple of families reach out to me and said that their experience, unfortunately they were here for family members, but they had a great experience with the hospital and had just a lot of positive things to say about the nurses and the doctors and the staff, so I think that's great. Just want to pass that along because we always need to hear good news. So, moving along, any new business? Hearing none, I will call the meeting adjourned.